Welcome, my dear friends. Myself, Professor Dr. Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. For paid online consultation, you can definitely WhatsApp on 922681060. My dear friend, today we are going to discuss about a very common problem nowadays, that is slip disc problem. Because of the wrong posture and continuously sitting in front of the computer or the sedentary lifestyle, we are getting this such type of the problem like slip discs. My dear friends, in this video, we will look possibilities of treatments about slip disc without surgery. And we will discuss all holistic approach, allopathy, Ayurveda, and yoga. In this picture, you can see how the vertebrae are having in our back and how is their structure. This is the normal disc. You can see the disc in between the two vertebrae is called as a normal disc, and when it is little bit coming out from that contained place, then it is giving the pressure on the spinal nerves, and then we are getting the musculoskeletal as well as neurological problems. So my dear friends, today we are going to talk about a common health issue which is almost all you can find. Every second person is suffering from slip disc. Slip disc is also known as herniated disc. How does it happen? What are the symptoms? Is surgery necessary all the time? And can this slip disc problem is treated with Ayurveda and yoga? Let us start to understand. What is slip disc? Between the vertebrae of the spine, there is a soft jelly-like cushion known as a disc, which is working like a shock absorber. When this particular disc slips out of its position or sometimes ruptures, it is called a slip disc or herniated disc. This particular problem occurs mainly at two places. One is a lower back problem, by which the person is suffering from lumbago or low back pain, and the area is lumbar fourth and lumbar fifth vertebrae. The disc is prolapsed, or sometimes lumbar 5 or an S1, sacral 1. In this vertebrae, the slip gets out of the place. Or sometimes it can happen in the neck region, cervical 6 vertebra and cervical 7 vertebra. In between, the slip get prolapsed and you get the neck pain or cervical spondylosis. So cervical spondylosis or lumbar spondylosis both can happen with this slip disc problem. Now let us discuss some common causes of slip disc. The very common cause is aging process. That is because of the disc, intervertebral disc degeneration. But sometimes we have our own mistakes. Even the youngsters, they don't know about the proper positions, about the sitting, standing, walking, etc. So some person do this mistake, heavy lifting with improper posture or the poor posture. Then there is an accidental injury, which is called as a sudden injury or the trauma to the back. Then obesity is adding this problem of degeneration. Then our sedentary lifestyle and smoking, the nicotine in the cigar reduces the oxygen supply to the intervertebral disc. So what are the signs and symptoms of this intervertebral disc prolapse? Symptoms depend on where the disc has slipped. For example, if the disc is slipped in lower back, then naturally the person will suffer from pain radiating down the leg, and sciatica type of the problem can arise. Then there may be tingling or numbness. There may be muscle weakness to the legs, and the patient complaining of leg pain after walking or after running and feeling of tiredness. But if slip disc problem arises in the neck region, then the symptoms will pain radiating to arms, difficulty in neck movement, and sometimes headache can occur. Now, what the doctors, we people are doing in Ayurveda Academy or anywhere else, first we do the physical examination of the total physical examination, especially musculoskeletal examination and nervous system examination. So, one of the tests for sciatica is straight leg raise test, which is popularly known as SLR test, in which we ask the patient to lift his leg from the lying down position and we see the range of movement. If we feel that we want to diagnose exactly area and how much is the degeneration, then MRI of the spine or the vertebrae is the most reliable test. Sometimes to begin with, we also ask lumbosacral region X-ray. This is exactly not for slip disc, but to see the spine alignment to rule out the lordosis or scoliosis type of the problem, or sometimes we can detect another disease like Pott's disease or tuberculosis of the vertebrae. So here you can find the straight leg test. The patient is lying down on the bed. Then we ask the patient to lift the leg, first right side, then the left side. This is the range of movement. Here you get the 30-degree movement. Then this is pulse pain. When the patient starts pain at the 45 degrees and he cannot go up, then that is pulse pain. This straight leg test is for to detect the neurogenic compression. Okay, then this is the normal movement, range of movement 90 degrees. No pain at 90 degrees. That is, then that slip disc problem may not be there. Mechanical causes of back pain may be there. Okay, so this has been done to rule out the problem around lumbar and sacral vertebrae. Now, you may ask, doctor, you are saying that surgery is not required, surgery is not required. But no, my dear friend, surgery is sometimes very much indicated when there is a severe nerve compression and the patient is showing some neurological deficit. For example, he cannot move the fingers of the hands or the legs. That is showing the severe nerve compression. For example, foot drop is one of the signs that we find, then immediately surgery has to go for. Then there may be in some patient in advanced cases or some another problem is there, cauda equina syndrome, and there you will get loss of bladder or control or loss of bowel control. Then naturally surgery must be done. Then gradually, day by day, month by month, week by week, progressive muscle weakness may indicate you that irrespective of the treatment, the patient is worsening the condition. Don't wait, go for surgery. Pain not relieved after 6 weeks of consecutive, maybe allopathy, Ayurveda, homeopathy treatment, patient is not improving, better take the opinion of orthopedic surgeon. Now, but surgery is not required. Most of the cases, 90% can be treated of slip disc without surgery. When there is a mild to moderate pain, no severe nerve damage, then patient is responding to the medication, physiotherapy or Ayurveda, then need not to go for surgery. Slip disc, what are the preventive measures? Always you should think that prevention is better than cure. So everybody of us who don't have this slip disc problem and they want that they should not get the slip disc problem, then first regular exercises of the joints are very much important. Stretching exercises are important. Yoga exercises under the supervision of yoga teacher is compulsory. Then daily walk, most beneficial. Maintain the proper posture while sitting, standing, walking, lifting the object from the floor. Then strengthen the back and the core. Use orthopedic mattress if necessary. Lift any objects from the floor correctly, that is knee bent but back straight. Here are some correct postures and the wrong postures. He has bent his knees and then is lifting the weight. Here he is not bending the knees but directly bending his back, that is wrong. See the standing position, very straight, but here he is bending unnecessary the back region, that is a wrong position. Sitting position, this is correct. Your back should be very straight. Here he has given the bend to his back and that is the wrong position. Now let us talk about the different modalities of treatment. First, I am giving you the tips about allopathic treatment. Generally, allopathy doctors can use the tablet Combiflam, ibuprofen, or he may use the diclofenac sodium, that is wrong. So this is a painkiller type of the management. Non-steroidal anti-inflammatory drugs, NSAIDs. Sometimes muscle relaxants are used. In advanced cases, symptomatically, epidural steroid injections are given. Physiotherapy is given. Traction is very much essential and short-term bed rest is advised. Then very rarely surgery is required, which is like a microdiscectomy or laminectomy if necessary. See, here you can see the traction because these two vertebrae, lumbar vertebrae or sacral vertebrae, they are coming very near to each other and giving the pressure on the spinal nerves. So we can take these vertebrae, each other, they can make a distance with the help of this traction for few days only. In Ayurveda, Ayurveda is always talking about musculoskeletal and neurological problems as like Vata dosha imbalance. Because of the Vata provocating food, Vata provocating lifestyle, Vata dosha get vitiated. And we have to balance this Vata dosha. Some herbs are very much beneficial to control the Vata pain. Some of the examples of the medicines are Rasna Saptaka Kwath. Kwath is decoction. Maha Yogaraja Gugulu tablet. Especially Vata dosha vitiation is of two types. One is called as a Dhatu Kshayajanya Vata Prakop, that is because of some degeneration or deficiency. And another Vata dosha vitiation is Margavarodhajanya. I am sorry, these are the Sanskrit words, but this is obstructive pathology. Basically, in slip disc, when the vertebrae are degenerating, then that is a deficiency or degeneration type of Vata dosha problem, and we give the nourishment type of the Gugulu, which is called as a Maha Yogaraja Gugulu. But that is type of a tonic or rasayan for the maintenance purpose. But in the beginning, when slip disc problem is very much strong, lot of pressure is there, then we doctor are using Yogaraja Gugulu as Amapachak to remove the inflammation and toxins from that area. Then symptomatically, best analgesic in Ayurveda is Dashamularishta, 10 roots of the medicinal herbal plants. In Ayurveda, Panchakarma therapies or allied Panchakarmas, for example, Kati Basti, where we put the warm oil on the lower back, Snehana and Svedana, these are the standard management procedures for imbalance in Vata dosha. So oil massage and fermentation is very much beneficial. Basti or medicated enema for controlling the Vata dosha, like Anuvasana Basti, that is oil enema, or decoction enema, that is Niruha Basti. Then Patra Pinda Sved, herbal poties to in acute condition, but afterwards we also give Shali Shashtik Pinda Sved as a what you can say the palliative treatment. Panchakarma or allied Panchakarma not only reduces pain but also strengthening the muscles, ligaments, tendons, bones, overall strengthening of the spine, and that's why recurrence can be avoided. Some of the very important yoga postures, the patient should learn all these postures first through the yoga teacher, and then he can start practicing by himself. First is a Bhujangasana, useful for slip disc, that is a cobra pose. Then Makarasana or the crocodile pose. Then Setu Bandhasana, that is bridge pose. Shalabhasana, that is locust pose. And Ardha Matsyendrasana, that is half spiral twist. Avoid the forward bending or heavy twisting. So, my dear friends, slip disc is a common problem, but with timely diagnosis and proper treatment, you can recover without surgery. A right combination of allopathy, Ayurveda, Panchakarma, and yoga can bring the fasting relief and comfort to your life. My dear friends, if you found this video informative, please don't forget to like, share this video, and subscribe my Ayurveda Academy YouTube channel. Let us know in the comments which therapy you would like to try if you or your relative is suffering from slip disc. See you in the next video. Until then, stay healthy and take care of your spine. Thank you very much, and we are going to see in the next video. Take care and thank you very much.